Well, good morning. Very positive news. We have no new community cases in Queensland. We have one overseas acquired case in a child who is in hospital with their parents who are also positive. This will bring Queensland to 29 active cases. I want to thank all the Queenslanders who have, over the last 24 hours, come out and got tested. We've had 9,521 tests in Queensland. We want to see those numbers staying high. So again, if you or anyone in your household has any symptoms whatsoever, no matter how mild, please come out and get tested. So we want to see as many people continuing to be tested. So that brings our total cases that we have seen in Queensland to 1,291. Other positive news is the gentleman in Cairns has now been retested and is testing negative, which reinforces that this was a historical case. And we're very pleased and want to thank him for his cooperation. The investigation is ongoing in relation to the Grand Chancellor and the 6 cases that we have seen, but the Chief Health Officer will speak in a moment about what we are going to do going forward to all of those people who had worked at the Grand Chancellor. Now, this is separate to the close contacts of the cleaner and her partner in the community. But for those who have recently been asked to go into quarantine because they worked there or they had previously quarantined there or were quarantining and were due for release, that they will be able to come out earlier, and they'll be able to come out from 6 p.m. today, and I'll get the Chief Health Officer to speak directly to that. I know that there's been some media around a gentleman seeking exemption from hotel quarantine because of his terminally ill mother. Can I say that it is very difficult, and it has been throughout the period of dealing with COVID, in having to make these decisions in relation to people's loved ones and wanting to visit them when they're terminally ill. These decisions are made on a case-by-case basis, and in this occasion, it has been assessed that the exemption is not granted. Of course, Health will do everything they can to find other ways that there can be communication between this individual and his mother while he is quarantining. But we do know the risk is increasing from international arrivals. This gentleman came from Massachusetts. There's been 454,000 positive cases in that area. Globally, we are seeing the numbers creeping towards 100 million positive cases, but sadly, we have now seen overnight it hit a milestone of over 2 million deaths globally. 2,004,458 deaths globally. That is why we need to be very, very strict in relation to any exemptions that are made from hotel quarantine, because it's not just about the individual and their loved ones, but it's about the safety of all Queenslanders and all Australians to ensure that we do not get the spread of COVID, and particularly now that we are seeing new variants popping up around the globe. So we're already aware of the UK and the South African variant, but there are also other variants that are now starting to develop around the world, which are putting more at risk as far as an increase in infectious virus through the communities. I'll hand over to Dr. Young and then happy to take any questions.
Thank you, Minister. So one new case in Queensland overnight. It's a child who's recently travelled from South Africa and is in hospital with their parents. Otherwise, there have been no other cases, none associated with that cluster related to the Hotel Grand Chancellor, and the case that we had some concern about yesterday in Cairns has now been retested, and that retest says that they don't have any virus at all now, tested negative. So we're still waiting on the serology test results to be absolutely convinced, but I really believe that's a historical case. We have, of course, done contact tracing, and we're working with that person and their family and thank them for their cooperation. So we now are day 14 since I believe that incident happened at the Grand Chancellor that led to those infections in the hotel. So that, I believe that incident happened on the 2nd of January, so it's now 14 days and we haven't had any additional cases other than those 6 that we have told you about before. So that means 6 p.m. tonight, those guests who were transferred from the Grand Chancellor to the Westin will be able to leave quarantine as long as there isn't any other requirement that would stop them, of course. But this issue that led to the increase in their quarantine period has now ended, so they'll be able to leave at 6 p.m. Now, of course, if any of them can't make travel arrangements by then because they're travelling interstate or they're going elsewhere in Queensland, we'll be very happy for them to continue to stay in the hotel overnight. We won't ask them to go and find a different hotel. So we'll work with each of those individuals what suits them, but they'll be able to leave from 6 p.m. tonight. Similarly, all of the staff who have worked in the Grand Chancellor from the 30th of December onwards and were asked to go into 14 days quarantine from when they left work, if they haven't already been released from quarantine, can now leave quarantine. And we'll also let our colleagues interstate know, and we'll let the National Incident Room know that anyone who's gone interstate or overseas, there is no requirement if they were in Queensland for them to continue quarantine. There may be in other places, and we would leave it up to those other jurisdictions what they do with all of those people. So that's excellent. Then we still have contacts who came into contact with the cleaner or her partner out in the community. So their 14 days depends on when that contact occurred. So not all of those, of course, are out of quarantine at this stage. So we've got 2 different requirements here. We've got the people who've been related to the hotel itself. Then we've got the people who've been related to the cleaner and her partner. So we need to be very clear we don't mix those two groups together. But this is all very good news. It means that I believe, due to very quick work by a lot of people and by the people of Greater Brisbane, that there is every chance we have contained this cluster. A little bit too early to say. We've still got to wait for that 14 days from when people had contact in the community before we can be certain, but it is looking promising. But I still ask anyone with any symptoms anywhere in the state at all, please just come forward and get tested. We did see an increase in the number of people who came forward and got tested yesterday compared to the day before, which is good, but I would like to see even more. I suspect there's not a lot of respiratory disease out there, which is a very good thing. It's summer in Queensland, but there's still some. So it's really important. Any symptoms at all, please just come forward and get tested. We've got fever clinics all through the state. There are no waiting times at the moment, so now's the time. Just come forward and get tested. And then, questions to the Minister?
Questions? So there were a number of people who had completed their 14 days quarantine at the Grand Chancellor, who were then being asked to go back into quarantine or remain in quarantine. So they will be able to leave. Also workers who, not the ones who were the close contacts with the cleaner, but other workers who had worked since the 30th of December, who were asked to go into quarantine, and of course all those who had previously done quarantine who had been released but were traced and contacted and asked to go back into quarantine. I don't have the total numbers of those. I believe there was about 30 people at the Grand Chancellor who were due to leave because they had completed their 14 days, who were then asked to remain in quarantine. So I believe there's at least 30 of those who are in the Westin at the moment, plus the additional staff and the other previous guests who will be leaving. But of course, as Dr. Young has said, that those who are close contacts of the cleaner in the community, and her partner will still need to complete their 14 days. And anyone else who was in the Grand Chancellor who's moved over to the Western, who is still in their original 14-day quarantine period, will continue that 14-day quarantine period. Any other questions?
So the remainder ones who are still in their requested transfer from the Grand Chancellor, will it just be 2 weeks total, or has it reset to day 06 to transfer?
I'll get Dr Young to clarify that, but I believe it's 14 days from when they had contact with the cleaner or partner. Do you want to?
So their quarantine did reset because I didn't know at what stage the incident had happened. I really and truly didn't know whether it was the 11th or whether it was the 30th of December. So there was that whole span that it could have happened. But we've now, through looking at what's happened to date, been able to clarify that the incident that led to the transmission of the virus happened on the 2nd. So that's why it's now 14 days. So yes, everyone, when they were moved out of the Western, out of the Hotel Grand Chancellor to the Western, their quarantine reset at that point for an additional 14 days. But now that I've got this clarification, I'm able to bring that back and reset that point from the 2nd. And so it's 14 days today.
Do they get retested?
They've all been retested and they're all negative.
Have they been notified that they'll be able to leave?
They're getting notified as we speak. Yes, so that decision was made this morning when I got all of those additional results to ensure that there weren't any positives, so that 14-day period had finished, and so we're coming out immediately. So they're getting told probably the same time you're getting told.
Is that development that now they're able to leave earlier, is that because of the development of the police investigation, or is that
No.
other information?
No, that's my investigation that I've done because I needed to try and work out when this happened. So right at the start, the earliest it could have happened is the 30th of December because that's when that gentleman arrived from the UK. But I didn't know the latest it could happen. So that's why I set those time frames.
And of those 147 guests originally, some haven't been tracked down yet because they're on ships. Have they been contacted yet, or still?
I don't know. The National Incident Room did that, so there's an international protocol for when countries have cases that then depart and go to other countries, the focal point is told. That worked very, very effectively early on in the pandemic. I'm not sure how effectively it's working now, given that we're over 93 million cases. No, there isn't, because we don't believe the incubation period is any longer. If we get additional information that suggests something different, then of course we'll modify that. But at this point in time, the incubation period is still 14 days. Now, the isolation period, that's when someone tests positive for the disease, has been lengthened. It used to be 10 days, it's now 14 days, which is confusing. So for people who have the UK strain or the South African strain, or I should more correctly say, one of those variants, B117 or the other variant, they now, when they get tested, have to remain in isolation for 14 days and then have to have a clearance test, so to make sure that they've cleared the virus.
The Minister mentioned the case of the Martiella family, you might have seen that. So obviously an exemption won't be granted. Are there any concessions that can be made so he can see his mum, or is it just going to be on the fine? Is there anything we can do?
Well, I'm not sure, but they're very, very good hospitals, so I'm sure they've already considered that. But my question would be, because I've only just recently become aware of it, is whether or not they've organised video conferencing, something like that. I think that's important to do.
There's no way he would be transported. I mean, sort of in the context we saw sort of people with the UK strain transported safely in an ambulance, they might be watching this and go, why couldn't we do that? So
Because it's very different. You've then got someone who's potentially infectious sitting with a relative for a period. They're not sitting in full PPE, being managed by health staff for a purpose, which is to interpret for their father who's unwell. There's someone who wants to come, and of course he would. You couldn't hold him back. He'd want to, hug his mum. It just can't happen safely. It's tragic. It is awful, and I feel for him very, very much. And I hope his mother does survive the 14 days so that he can go and see her.
I guess the argument could be made, and it's sad to say, they fear that she won't make it through the 14
Yeah,
days.
it's sad.
If she's terminally ill anyway, could we grant an exemption where he's in PPE, and I'm simply asking the question, go there when it's just them in the room? But it's just
These are a lot of hypotheticals, but I'll just explain to you. We've seen this very, very rapidly transfer within 24, 48 hours. So he could transfer it to her and then she could transfer it to someone else. So it's just, the risk is too high. We have kept this virus to the greatest extent possible out of our community. Every time we have one case, we can see what enormous impact it's had. We cannot risk a case coming through, even in the most tragic of circumstances like this family. Any other questions?
Just to clarify on that, I guess, what is the risk difference between that and the girl then who went with her father to hospital?
Because she was wearing full PPE, she wasn't going there to visit someone, she was being managed by the health staff to be kept separate from her father, who already had been in contact. So really, if she was with her father, it's not a problem, but she was kept separate from anyone else. So she was managed in a negative pressure room. It was all managed. It's totally, totally different. She was almost a healthcare provider in terms of why she was there, because she was providing interpreting services. She wasn't there to assist her father in terms of him being unwell. She was there to provide interpreting services.
These stories keep coming up, obviously.
Of course they do.
In a broader sense, we're going to be living this with it for a while, right? Is there something that could be changed, processes, protocol on a larger scale? So we're not constantly asking you about is that the concessions can be made, or is it simply at this stage in a pandemic, it's just people aren't going to be able to say goodbye to their loved one? That's just something we have to do.
I've been saying that for a while now. Once we knew about this new B117 strain, I said we would have to tighten up those exemptions, and we have. They're very, very tight.
In light of the good news in Queensland that's coming out, would you be expecting or encouraging other states to, I guess, reopen their borders to Greater Brisbane?
That's not my role. Each state will make an independent assessment of what the risks are in their state and what is best for their population. They don't advise me when I should advise the Premier about closing our borders. I would never advise them. That is, I give them the facts of what is going on in Queensland, and then they make a decision based on those facts, and they advise their government their advice.
We've had a few days now of no community transmission. Are you confident there's no virus out there in the community undetected?
I'm hopeful. I'm not confident. I'm hopeful. So I really, really do ask that everyone, any symptoms at all, no matter how mild, just come forward and get tested. And I am enormously grateful to that cleaner. So she was the first case in that cluster, the first one, and we found her. So due to her. And that's what I always want to happen. I want to find the first case in a cluster, because we can act quickly and we can close it down, and hopefully then at the end we can say we had a cluster with 6 cases. That's my hope. It's a little bit early to be too confident. We need to go through the 14 days.
Just back on people being released from the West End, is that so that number today of people being released is around 30?
No, there's a whole lot of different numbers. So we just need to go through them all, because it depends where they were in their quarantine period, but there will be no additional time needed now because of what happened at the Grand Chancellor. So we just have to go through each one of those cases, and that work's been happening now, just to work out where they were up to and who can get released after 6 p.m. But anyone who was, so that's where that number came from, that 30, anyone who had finished their quarantine period, or was just about to finish it when we had to move them, they can of course all go at 6 p.m. Thank you.